Hi, my name is David Candelaria. I'm the Josephine County Public Health Officer. And I'm here alone today because I'm going to be talking about a more serious topic, and that is mortality. Specifically, I want to talk about what happens if someone dies and what kind of documentation is completed, and how does this coronavirus pandemic affect that. What drives this question, I think, is people really want to know where is this disease and how is it affecting people and how many people live and how many people die. And a lot of that information ultimately comes out in a death certificate. So a death certificate is completed on anyone who dies, and it's officially signed by the person's primary care physician, who presumably knows the most about the person. Sometimes people don't have a primary care physician, so the responsibility of the death certificate signing falls to either the medical examiner or someone like me. There's two important parts of a death certificate. The death certificate wants to know the manner of death, and it wants to know the cause of death. The manner of death is pretty straightforward. That can be a natural manner or an accidental manner. There's also a category for homicide or suicide, and there's even a category of could not be determined. Sometimes people are found, and there isn't any clear way to find out how they died, and so that would be where someone would check the box that said could not determine the manner of death. But what's more pertinent, I think, in this coronavirus time is the cause of death. So causes of death can be lots of things. Could be a heart attack, it could be pneumonia, could be bleeding ulcer. But if we talk about coronavirus, what you would, I think, ideally write in the cause of death, it would be hypoxemia or lack of oxygen. And then there are several kind of subcategories to this cause of death. So the immediate cause of death would be lack of oxygen due to pneumonia, due to underlying cause such as maybe asthma. And then there's a whole little separate section where it says factors that could have contributed to death, and you might put down something like underlying coronary artery disease or underlying diabetes. What I've heard is people who have underlying lung disease like asthma or COPD might get a coronavirus infection, and that could well be the underlying cause of their death. Other people who have other medical conditions like a heart attack who also test positive for coronavirus, I think people are worried that coronavirus will be labeled as the cause of their death when in fact maybe they had a heart attack and maybe coronavirus played a part and maybe it didn't. It's not easy to tease all that out, and that's why there's all these lines for associated medical conditions. But fundamentally, the person who's ultimately responsible for completing the death certificate, whether it's the primary care physician or the medical examiner, uses their best judgment to stratify and prioritize what was the ultimate cause of death. So that's kind of a short course on what's in a death certificate and what kind of thinking goes into filling it out. Another thing that's happened during this coronavirus pandemic is sometimes people die at home or unattended. And there's a question, was this person's death related to coronavirus, or did this person die from something else? And sometimes you have other medical information and sometimes you don't. When we've asked the Oregon Health Authority about testing for coronavirus in these people whose deaths are otherwise unattended, their advice is if there was any history of a recent respiratory illness or any suggestion in the findings around the scene of the death that a respiratory condition was present, they want to do sampling for coronavirus. If that test comes back positive, that person will be counted as both a case and a death for the county. If the coronavirus isn't detected, then other causes of death have to be considered and listed on the death certificate. So I hope that helps you understand how coronavirus is being considered in cases of death where it's not really clear, or in people who may die and they have other underlying medical conditions. It's not a slam dunk that coronavirus is the cause of everybody's death, even if they test positive, but sometimes it can be, and sometimes it's not entirely clear. So hopefully that helps you understand it a little better. If I learn anything more from the state about better delineating a cause of death with coronavirus or not, I'll be back to let you know.